Next, we're going to talk about dental decay, gingivitis, etc. This is a bigger problem than most people understand. If you look back, and we'll go back to Harvard again, Harvard just published a study 3 years ago where they showed that the choroidal artery, the artery that's in the neck going up the side from behind the ear down, was not being clogged by the historic and classic overeating meats and overeating dairies and lack of exercise. It was from bacteria in the mouth. Now listen closely. This taught us something. This taught me something. And this is why I never ever stop reading medical research. As much as most of it is funded by the pharmaceutical industry, they still occasionally, by mistake, do good studies. And bottom line is that bacteria can possibly cause strokes and certainly cardiovascular disease. It doesn't stop in that artery. It goes through the body, and that bacterial or infectious microbial activity starts to weaken the overall system and obviously go back to the immune system, compromise the immune system by using it to get rid of that versus having the immune system preventing oncoming diseases. Keep going further than that. We did a 5-year observation study when guests came into the Institute where we actually had them take swabs from their mouth with little toothpicks. We then, as research, looked at it microscopically. We hadn't found one person who didn't have a spirocate in their mouth. Spirocate, and there's a wide family of these things, and we're all just starting to learn about them, actually is the family that Lyme's disease comes from. Pretty scary stuff. But all of us, even those of us who eat this way, grant you have minimal amounts of it, the vast majority of people have shockingly high amounts of this in their mouth. So thank goodness we were, for years, a colleague with Dr. Jim Harrison. And Dr. Harrison, by bad luck and good luck, had a very serious car accident and couldn't practice dentistry, which he was a complementary dentist and did biologically correct dentistry. No mercury fillings, no root canals, biological dentistry. He took his mind after that tragic event occurred and placed it together with one of the great herbal formulators in the world, the owner of Biobotanical Herbal, the largest herbal company on the planet, and went around and discovered different herbs that could literally kill all of those microbes, and then including spirocate. And they put together a product called Perio Paste and Perio Liquids too. What I've learned, and again, this is a peripheral knowledge for me. This is not my expertise. We do have biological dentist, Dr. Matlock, who's been practicing 30 years proper dentistry, that is associated and works with the Institute and educates our guests. But what I do know about this is that when you are trying to really keep gingivitis and dental decay down, you must first floss at least 2 times a day, and ideally after you eat any meal, floss. Second, ideally, you would take a water pressure device, water picks or the other variations of those type of water devices. Put some of these perio fluids, perio liquids in it that have these antimicrobial, anti-mutagenic herbs in it that literally kill it. We did the work for them and looked at it. And you use that. It also stimulates the gums, which brings healthy blood flow up there, kills all of the microbial problems, and also cleans between the teeth in places you can't do it with a brush. Better than nothing would be to use a brush and then, of course, use the Perio Paste. I'm placed in a position as I travel globally and speak, I take a toothbrush and I take, the Perio Paste with me. Frankly, there should be no other oral substance that anyone on the planet uses than this. You can find these in health stores, of course. The shop on campus has it at Hippocrates, and also Alive Raw has that available.